Hello, everyone, and welcome. We are Nothing Pink, located in Rock Hill, South Carolina, and we are glad to have Dajen Williams join us tonight. She is with Novant Health Cancer Institute and is a clinical pharmacist. We're excited for the conversation and questions. And we'll open with Eric. He is the clinic administrator at Novant Health Cancer Institute in the Integrative Medicine department. So thanks for being with us tonight, Eric and Dajen. Eric, I'll have you start.
All right. Thanks, Carrie. Thanks for having us. I really appreciate it. My name's Eric Draheim, and I've been the clinic administrator at Novant for almost 2 years. I've been with the company for 3.5 years. And what we offer at the clinic is we have Dr. Harden, and his appointments are more of a consultation where it's a whole person approach to things, where he will discuss things such as diet, exercise, mindfulness, healthful ways to cope with any stress and anxiety you may be dealing with, what kind of support you're getting. And then, of course, we have the pharmacist, which you'll hear about tonight with Dajen. They specialize in natural supplements, and they can guide you towards what supplements you may want to start taking. Just as important, supplements not to take because they can interfere with depending on what kind of treatment you may be going through. And we do also offer acupuncture and massage at the clinic, which can help with a wide variety of either side effects from treatment, or if you're having sleep issues, whether you can't sleep or you're feeling fatigued, headaches, nausea, neuropathy is a big issue that a lot of the people who come to the clinic are getting acupuncture in particular to help with neuropathy. And that's pretty much in a nutshell what we do offer at the clinic, and it's available to anyone really, as far as especially with the acupuncture and massage, that's available to you don't need a referral, you don't need really any kind of a referral from a physician. You can just call us up and we can schedule acupuncture and massage for you. It helps with patients, caregivers, family members, anything like that. Um, so that's it. Everything we offer at Integrative Medicine.
Wonderful. Thank you, Eric. And Dajen Williams, thank you so much for being with us tonight. And we're interested to hear about your presentation.
Hi, everyone. I'm Dajen Williams. Like they said, I'm an integrative medicine pharmacist with Novant in the cancer clinic. And I also am a 10-year breast cancer survivor. So I've kind of walked this path. Was very fortunate to end up in a career that I can relate on a very personal level with my patients, but also hopefully help minimize side effects, but also improve overall health and decrease risk of recurrence in many cases. So, like Eric said, we focus on the full patient, everything, not just one disease state. And as some of you probably know, cancer is a roller coaster of emotions, and the mental aspect of it is a lot of the big picture too. So, not just the physical. So, tonight I will talk about safe supplement use, talking about prevention, treatment, and survivorship. So, the objectives that we will cover: what is an integrative pharmacist? What do I do? Promote overall health and manage side effects of treatment, safe use of vitamins and supplements, and then how you can connect with an integrative pharmacist and kind of what that looks like. All right. So, our approach, and in this little cartoon, as you can see, there is a picture of a pharmacist meeting with a patient with many, many supplement bottles. And some patients come into our clinic and they honestly have no idea why they're there, what integrative medicine is, what it means. And so some patients might think we push a lot of supplements on them. We actually, in most cases, probably try to minimize what a patient is taking more than we try to encourage use, because things can be dangerous as well as helpful. So prior to meeting with a patient, we look at the patient's chart. We review all of the information that we have to create a very individualized patient plan. So every patient experience is going to be a little bit different. Recommendations will be different. We ask that you bring all medication and supplement bottles to the appointment. And then supplements are reviewed with the patient. We talk about usage, how you take the vitamin or supplement. We talk about safety and efficacy because with supplements, there's very little regulation and safety is often a concern. And then we also talk about quality of products and how you know if you're getting a good quality product. And there can also be financial concerns. And again, we don't want a patient to leave and go start many new supplements ever. Post visit, we look at quality of products that you may have brought in that we were unsure of. And then we also check for drug interactions with things that were not on your chart before our patient appointment. And then all patient recommendations are submitted in my chart so your entire care team can see. And we also send the patient a message on my chart with everything that we cover in our meeting. So you can come in, you can just kind of sit, listen, relax. You don't have to feel like you have to keep up with everything that we're talking about and take good notes. Novant Health, what do we say about supplement use? So again, there is no defined rule about supplement use. It is very patient specific. Every patient is treated as an individual, and we help manage whatever a patient comes in looking for, and it can be so different. To promote overall health, help manage side effects, and decrease risk of recurrence. So those are our main goals. And then a general guideline is to avoid antioxidants during chemotherapy and radiation, but we do encourage that you eat an antioxidant rich diet. So these would be things like vitamin C, turmeric, zinc, vitamin E, vitamin A. These are antioxidants, and theoretically, they could interfere with the treatment from being as effective. So again, safety is our primary concern. Herbs and supplements are very lightly regulated, allowing dangerous products on the market. We all know social media is a huge influence. Marketing is insane. The amount of money that is spent on supplements continues to increase. And poor quality products can be contaminated with things like bacteria, heavy metals, fungi. A big one that we run into is lead contamination. And so part of what we do is recommend products that have been third-party tested by consumer lab. So they're not funded by any manufacturer, any company, and they test for making sure a product has what it says it has, but they also look for contaminants. And they also compare kind of with cost, which is really nice because the most expensive products are by far usually not the best products. All natural on a bottle does not mean that a product is safe, and it's very important that you always let your doctor or your caregivers know that any vitamins and supplements that you take because they can easily interfere with medications, they can interfere with disease states, they can interfere with other supplements that you take. So really important to include anything on your chart if possible. And just to kind of show how lightly products are regulated, a study done in 2015 of 22 probiotic products labeled as gluten-free, 8 of those 22 contained gluten. So this just goes to show you can't always rely on what is on a supplement package. Some common mistakes that are made with supplements: using supplements that could have drug interactions that could interfere with lab testing or procedures. A big one that comes up here is biotin. Biotin is often recommended, especially after maybe chemotherapy, to help with hair, nail strength, especially. Biotin can interfere with thyroid lab test. It does not interfere with your thyroid, so it's just really important that you stop it and hold it for at least a week prior to having thyroid labs checked. Other supplements that can interfere are things like omega-3s, fish oil, turmeric. These can increase risk of bleeding, so you would want to stop them prior to any surgery or procedure like a colonoscopy. Um, and then things that can have drug interactions. Often patients may be on blood thinners, and there are a lot of drug interactions with blood thinners and vitamins and supplements. Taking supplements advertised to treat or cure a disease. So, just super important to not rely heavily on marketing, social media, because a supplement is not an approved drug. And so, it has not been proven to treat or cure any disease. We can say this may help you or this might help this side effect, but a supplement doesn't treat or cure. And then taking too many supplements and spending too much on worthless supplements. So, we again do not want patients to be on a large number of supplements because it just increases risk of drug interactions, money wasted that could be better spent elsewhere. Um, and many times, like multi-level marketing companies will push a lot of supplements, and those are usually, they sometimes can be good quality, but they usually are way more expensive than you could get a higher quality product. And the amounts of active ingredient often are very low and not enough to truly be effective. And then these are just some examples of quality online supplement sites. Vitacost.com, iHerb.com, and evitamins.com. I have a large number of patients who will come in and they get all of their products on Amazon. Sometimes Amazon is fine as sourcing supplements. Other times we have run into issues with um, quality and counterfeit products. And so, what I recommend is if you're ordering from Amazon, to be sure that your product is coming from the actual store or manufacturer that it is made by and not from a third party. Some ways that you can learn more about supplements. These are just some sites that you can visit: Memorial Sloan Kettering, About Herbs, the American Cancer Society, Dietary Supplements, What is Safe, the National Institute of Health, National Center for Complementary and Integrative Health, drweil.com. So Dr. Weil is an integrative medicine physician who is known around the world actually, but started the first integrative medicine school for doctors and a fellowship at the University of Arizona. And on his website, you can actually go and type in like any type of issue that you're having as far as like a side effect or a disease state. You can type in the name of a supplement and you get really good clinical information, but in lay terms. So very easy to understand, but backed by science, not just opinion. And then finally, Consumer Lab, which is the third party testing that we use for helping recommend products to our patients. And this one does require a yearly fee. So this one I would only recommend to a patient who is super, super interested in a lot of different supplements and just really likes to do a lot of research, because it can be quite overwhelming trying to even kind of navigate through that site. How to connect with an integrated medicine provider. Like Eric said, you don't need a referral for our office. We see mostly cancer patients, but we do see patients who are not cancer patients as well. And our main office is on Queens Road in Charlotte. And then we also have a Winston-Salem location. This is our website here, have our phone number listed, so you'll all have access to this. And again, when you do come in, sometimes you'll meet like with the pharmacist and then with the integrative medicine physician. And so, as the pharmacist, I cover supplements, and then Dr. Harden or Dr. Baldwin come in and they will meet with you to discuss other aspects of integrative medicine. And that concludes my presentation, but I am happy to open up for questions.
Thank you so much, Dajen. Wow, this was already a lot of great information and good resources to follow up on. And one of my big questions was the quality, to know good sites to go to. And, I think you highlighted so many great points of being able to share all of our supplements with our providers, just
Yeah.
even if we think it's not that, oh, I just been taking these forever, but they might have some interactions with treatment and, to be sure to express all of those. So thank you so much for this wealth of
Welcome.
information and your time tonight. It was great to meet with you.
Thank you.